Hi, so I'm just going to go over briefly some of the pros and cons of being a resident at University of Pittsburgh versus maybe other places or other types of residency. So one of the biggest, be it a pro or a con, but factors of the oral path residency at Pitt is that you are treated more like an employee than a student. So it's pretty different than coming from dental school where your time is very spoken for, attendance is mandatory, you're expected to be here at a certain time, and we're studying these chapters on these weeks. You're given a syllabus, and that's not really up to you. So at Pitt, your time is very structured, how you best see fit. Other than kind of some of the things that we went over, the coming to sign out, and we do have conferences. We go over an unknown slide conference every week where we receive slides from um, other oral pathology programs that we usually work up on our own and then go over with Dr. Summerskill, as well as clinical pathologic correlations where Dr. Summerskill shows clinical images of different lesions or radiographs, and we come up with a list of differentials, questions we might ask that patient, and then a weekly journal club where we talk about just something that's come up either at during sign out or on a rotation, something we find interesting, and we talk about that for an hour. We also have a couple time set things that come from UPMC as a whole, as far as the medical pathology. So they do 2 sessions every week, an AP didactics, anatomic pathology didactics, as well as AP grand rounds. And those are medical pathologists that are training other medical pathologists, and we get to sit in on those via Zoom. And it's good to learn sort of some more full body pathology. Some of it is obviously more relevant to us as oral pathologists than others. Obviously, we're going to make it a point to attend anything that's related to salivary gland pathology or head and neck. Lymphoproliferative disorders, anything like that. Some of the things are a little less relevant to us. Pediatric GU pathology doesn't pertain to us as much, but we attend that as much as we can. And then we have a slide conference with the head and neck pathologists from 4 to 5 p.m. on Tuesdays every week. And that's where they sit down and show interesting cases, things that either they just found unique or that they might want to get ideas from the other pathologists. So that's an awesome resource in the week to sit in on. Other than those things that are set throughout the week, your time is quite flexible, less so when you're on biopsy service, but that's a good thing in the sense that you are not doing a ton of busy work. You can structure your time in the areas that you need the most help with. If you want to focus only on salivary gland neoplasms, you can do that. If you have a big research project going at the time and you are less focused on maybe textbook studying and you want to focus on that, you can do that. But it is up to you. It is very self-driven and self-motivating. So I find it helpful to kind of make a syllabus for myself. I'd like to read these chapters by these days, but it is something that you will have to do yourself, whereas in dental school and maybe at another program, they might kind of set that schedule for you, but you'll have to be very much a self-starter to be successful at this program. So that's both a pro and a con. I consider it a pro, but for some people, if you require that structure, then that might be a little bit lacking here. Another big pro of being at Pitt is the head and neck pathology department. The head and neck pathologists here are world-renowned, and getting to learn from them and work under them is a huge pro. I also think a huge advantage of our program is that our rotations are spread out throughout our residency. So rather than we do all of our head and neck rotations in 3 months in your second year. They're spread out. You get a couple weeks here and there. I think that's helpful, especially with head and neck rotations because of the repetition. You're learning a lot in a short amount of time, and you're not going to retain it all. But the fact that you're going to come back on this rotation in a month and kind of get inundated with some of that information again really helps it cement. And it also just kind of breaks up any monotony. You'll spend a month at the dental school and then you'll go on rotation and then you'll come back and it kind of keeps things fresh, keeps things exciting. So I think that that's a huge pro. Another pro of being here is that you get to live in Pittsburgh, which I think is great. I am Southern, if that's not obvious, and I went to dental school in New England. So I've kind of lived in a lot of different areas in a lot of different cities, and I think Pittsburgh's a really good size. I think we are a paid program with a salary, and I think that you can live comfortably as a resident in Pittsburgh on that salary. Um, Obviously, everyone's life circumstances are different, but I think that Pittsburgh has a lot to offer. It's easy to get around. You can have a car, you cannot have a car, both are doable. And there's a lot to do without being super overwhelming or crazy expensive. So I think that it's a great place to be a resident. Some of the cons, some of the things that make being here maybe more difficult, the biggest one is being on call. You are expected, at least right now, the program is structured that you are on call 1/4 of your time in your first year. So it ends up being a week every month. Sometimes that's scattered out, but call is tough. The procedures that you're doing are not technically difficult. You're either incising and draining abscesses or dealing with dental trauma, like you're splinting loose teeth together with composite and ortho wire. A lot of what you're doing too is just triaging patient phone calls. So patient will call the hospital wanting to know with a dental question, and then they'll call you and you'll have to talk to the patient and kind of walk them through what you think, whether they should go to the emergency room or whether they should take pain medication, whatever. It's again, the procedures are not technically difficult, but your life is kind of on hold for those days that you're on call. You can't go out of town, and the fact that the pager could ring at any moment, it does induce a little bit of anxiety. You will get called in the middle of the night. You will have to get up and go in the middle of the night, sometimes multiple times in the night, and so that happens, and that's a bummer. But I do think that it makes for increases your number of patient interactions, which is always good, and I think it's a nice thing to have on a resume. So there's a bright side to that as well, but it is tough. Another thing that could be considered a con is we do quite a bit of our lab duties at Pitt. So we do all the grossing, whereas rather than doing like a grossing rotation where you get exposure to it, but you're not expected to do it all the time, we do it all the time. Occasionally we'll help check in the cases. It's called accessioning, and deal with some of the paperwork and contacting the clinicians, calling for radiographs, things like that. So we as the residents are very hands-on with the management of the cases and the management of the lab. There's a lot to learn from that, but it is some extra work that's not directly related to learning pathology. So that, again, there are bright sides to it, but could be considered a con. I think there would be pros and cons anywhere. A lot of it is how you look at it and what you choose to gain from the experience. Obviously, I'm very happy here. But if anybody has any more questions about specific things that they're concerned about, please reach out. We'd be happy to answer honestly. Anything else, our take on any aspects of the program. But those are just in general some pros and cons of being at Pittsburgh.